I'm a cardiologist, and I wanted to talk today about the process of how patients come in for a second opinion here at Mass General Hospital. When a patient initially comes, there are almost several pain points, but they're all combined. When they initially come, they're referred from another cardiologist. They therefore have notes and history with that cardiologist, various imaging studies that they've had, and those don't come in a structured way. Some may come via fax, some may come by mail, some the patient brings, some don't make it before the patient's appointment, and we get it afterwards. The images oftentimes can't be uploaded in our system, and there's not a clear way into which to get these images into our system. I also often need to get additional testing on these patients who live significantly far away. So for the patient, it's very difficult for them to then come back in and get additional tests so that I can tell them what I think. It would be ideal if these patients could come in knowing what additional testing they needed and get that perhaps the same day as when they see me, with quick turnaround of the results so that I had the results and could make an opinion for them. Additionally, these patients oftentimes need to see not only myself but an interventional cardiologist or a surgeon, and it would be helpful to have those individuals available on the same day in those cases where needed to see these patients as a unit. The frequency of this happening is probably about 6 new patients a week who come from significantly far away, and this is an issue. And for those 6 new patients a week, we right now don't have a very good system beyond what I've just shared with you. In terms of efforts to already try and solve this, we have multidisciplinary clinics where the surgeon and I see patients together. However, that occurs at the second visit after I've already met the patient, gathered their information, put it together, seen the imaging, send them away, and then perhaps get imaging the second time when I see them with the surgeon that needed to be ordered. I think there's a more efficient way to bring patients in from the outside and get all of this done in a coherent manner to make it easier for us to render an opinion as a multidisciplinary group, for the care provider to get one answer and not stepwise answers to their patient's issues, and for the patient to not have to have an experience where they're coming into Boston several times without clear answers as to what is wrong with their health. I would also love to title this something. I don't have a terminology to use as to what this problem is, and if anyone can think of something catchy, that would be helpful. Thank you.